Hi everyone, so welcome to today's video. Today we are going to talk about possible reasons why some women collapse during pregnancy. Okay, so you've heard it before that a woman who was pregnant, all of a sudden she collapsed. So what are the possible reasons? Okay, one, there's something we call hypoglycemia. So don't be worried, it's not a big word. Hypoglycemia simply means that the sugar levels in the pregnant woman has gone down, especially for pregnant women with gestational diabetes. If you do not control your sugar well, if you do not eat on time, if you're not on the right amount of insulin, it can lead to hypoglycemia, and then the woman collapses when you do not expect it. Okay, so one of the reasons why I have seen women collapse and being brought to the hospital is also high blood pressure. High blood pressure, which results in what we call eclampsia. So in an eclampsia, the woman's blood pressure was not well controlled, and so she fits. She fits. It's like just like that of an epileptic attack. She fits and loses consciousness. And so, if you're pregnant and you've been diagnosed with high blood pressure, you really need to be careful about it. Okay. Then we can also talk about dehydration. Okay. Some people can get to the extent when you're having very severe nausea, vomiting, nothing is staying down there. Hyperemesis, we call it hyperemesis gravidarum. The woman is vomiting, cannot take anything. You need replacement. And so if you do not you are not given infusions or something to replace it, and it is too much extreme dehydration, it can lead the woman to faint suddenly or collapse. Okay, and so you need to be careful. I've actually seen somebody who was paralyzed because of dehydration. So it is something that you need to be careful about. Yes, and one thing I've also seen with my own eyes is about ectopic pregnancy. Okay, so not just the fact that she has an ectopic pregnancy and so she has lost consciousness. It is because of a ruptured ectopic, and the woman is losing a lot of blood internally. And so you know the blood um, sends you need blood to your brain and all that. Meanwhile, this blood, because of a complication, is all being kept in the abdomen. It can lead to reduced blood supply to the brain, and it can result in sudden collapse of the woman, and she has to be right. That is why you need to do an early scan. Okay, you need to do an early scan when you are pregnant, okay, to avoid complications like this. Yes, I'll also talk about pulmonary em- embolism. For that one, is like there's a clot that is preventing enough blood to reach the lungs, and so it increases uh, it causes you to, let me see, blood clot travels to the lungs. Okay, so your the blood clot travels to the lung. Pregnancy in itself increases the risk of blood clots. The symptoms: chest pain, shortness of breath, fast heart rate, collapsing. This is life threatening. I pray no woman gets there. Okay, yes, so please make sure you are always active when you are pregnant to prevent some of the things that I have mentioned here. And then women with let's say anemia. Okay, if your blood level is extremely low, it can lead to reduced blood supply to your vital organs, including your brain. And because it's causing shortness of breath and all that, you can easily faint. So you would want to make sure that your blood level is always high. Your baby is taking, the mother is taking. If you are not careful, you will cause a lot of harm. Okay, and let me say, complications of pregnancy, like even placenta previa, okay, or placenta previa that has resulted in placenta abruption. Abruption means that the placenta is separating prematurely and the woman is bleeding, just like ectopic. It can also result in sudden collapse. Okay, and so you need to be very careful with your antenatal care assessment and all that to make sure that you are safe. Yeah, so I think they mentioned the last point, which is also women with certain heart conditions. Maybe she was having a heart problem before pregnancy. She can also, because of the hypotension and all that, it can also result in hair fainting, dizziness, nausea. So when your BP is too high, it's not good. When it is too low, it is not good. Your normal heart blood pressure and pregnancy 120/80. Okay, yes, and you should know your normal. There can be a little variation, but you should know your normal. Okay, yeah. So these are the possible reasons why a woman could collapse during pregnancy. But when you do proper self care, going for antenatal, working with your doctor, working with your midwife, reporting early when you have certain symptoms, you are going to be okay. Yes, I hope that you like this video and you understand why some women do collapse during pregnancy. Do share, like, and leave a comment. Thank you. Bye.